welcome back to Yankee Chronicle. I'm your host, Abby Peel. November is Lung Cancer Awareness Month, and we are now joined by a few survivors that have a story to tell.
November is a really important month for survivors of lung cancer because it's Lung Cancer Awareness Month. And if there's any type of cancer that needs awareness around it, lung cancer is that. There's been a history of a stigma attached to it because of smoking. And now we're really finding that that's not realistic because Sarah and I are both non-smokers who were diagnosed with lung cancer unexpectedly.
We want to raise awareness about lung cancer, and historically lung cancer has been associated with smoking, but about 10 to 15% of people with lung cancer have never smoked.
It was the strangest thing. I was really healthy, really active. I work in a physical job, so I was doing a lot of physical work, and I had a regular doctor's appointment. I had a tiny little bump on my shoulder that turned out to be an inflamed lymph node, and through that they circled in on lung cancer that had metastasized.
I was diagnosed about 2 years ago, and I had about 6 months of a worsening cough. My voice was getting hoarse. I had some shortness of breath. But a week before I was diagnosed, I, with another woman, won a tennis tournament. There were about 30 people in the tennis tournament. So I really was not that symptomatic. My lung cancer came as a great shock, especially because I was never a smoker. And it turns out the type of lung cancer I have, there's no known reason for it. There's no environmental connections. And that's another area of research that's needed. The type I have, people tend to be non-smokers, and we tend to be women, and people tend to be under age 50. But about 10 to 15% of all people with lung cancer have never smoked. And because people are smoking less, the newer diagnoses tend to be with people that are non-smokers.
Initially I had no symptoms at all too. That's an important thing to add, except for that tiny little bump on my shoulder. At first, they didn't give me a good prognosis. I was really concerned about that. And then I went to Mass General, and they identified the genetic type of cancer. And luckily there's a targeted therapy for the type of cancer that I have. And I just take a daily pill that it has knocked the cancer back and keeps it under control.
I think the problem with being a never smoker is when you're being evaluated, when you have some of these symptoms, that's not the first place a physician would go to. I can't speak for them, but it's not part of the protocol to screen for lung cancer unless you're a smoker. So that is part of the problem. From my experience, I would recommend to people that had a worsening cough, voice changes, shortness of breath, to really push their primary care physician to investigate. And in my case, it was simply having a chest x-ray. So it's not something, you don't need major surgery. It's not anything you need to travel for. You can get it done at your local hospital.
One of the things we see universally with the friends that we've made who also have this disease is that it presents differently in every person. And you have to be really strong about advocating for yourself with your physician, so that, because both of us are non-smokers, we had none of the high risk factors for lung cancer, and we both have it.
Thanks, Sarah, Terry, and Gail. The truth is, lung cancer kills more than breast, prostate, and colon cancer combined, but receives less than 1/10 of the research funding. You can donate now by going to the Lung Cancer Foundation website to give.